The broadcast is now starting. All attendees are in listen-only mode.
All right, welcome everyone. While we're waiting to get started, I have a question for you all that will help me out during the presentation today. I typed this in the chat box. I think you all can see it there. Okay, yeah, it looks like you're already responding. I see one response here. Perfect, thanks, Laura. So now I know that our system can work. But my question was, I'm curious to know what your all's background is, particularly, how you think this training could potentially help you in your job. And I'm also curious to know what types of issues, presenting problems, are you typically trying to help people with in terms of behavior change or helping them do things that they've been having a hard time with. So I like to use examples that are relevant to you all. A lot of my examples have more to do with the work that I'm used to, which is more traditional healthcare settings. So I try to adapt some of that stuff to make it more relevant for what people are doing.
Yeah, thank you for starting us out with those awesome questions. Start thinking about all that before we begin with your presentation. So while you are all typing in those responses in the questions box, I just wanted to go over a couple housekeeping things. So again, welcome. My name is Alejandra Del Toro, and I am the project coordinator with Empower Idaho. Most of you should be familiar with our program. I know we have a lot of repeat attendees, but for those of you that are new, Empower Idaho is a nonprofit organization that provides behavioral health education to the public, as well as providers that are looking to get those continuation of the education credits, and also just providing advocacy for the community. We have Dr. Kyle Davis here with us today, teaching us a little bit more about motivational interviewing. And then before I officially hand it over, quick overview about the control panel. Everyone is muted, so the communication will solely be through the questions box. So that is where you are able to send your responses, and we'll be typing the questions out in the chat box. So if you get confused, just go into the questions drop down and ask your question there. Real quick about the CEU info, this information was already provided, but again, in order to qualify for that CEU, you need to attend the entire session and have joined through that individual link that was sent to you via email with the email that you registered with. And then we also ask that you complete the evaluation that is sent to you to your email. So once you complete all of those, we'll be issuing certificates within the next week or two. So without further ado, I'll hand it over to Dr. Davis. Thank you.
Yeah, thanks, Alejandra. I'm really interested in all the responses I'm getting here about people's backgrounds and the kind of work they do. It looks like we got a really diverse group here in terms of the kinds of work, everything from social work in the hospital to working at Boise State with student engagement, people doing forensic evaluations, but our common theme here is everybody in this group is probably trying to help people do things that would improve the quality of the people they're working with lives. So that's helpful for me to know that we've got more of a diverse crowd. And so I'll use a variety of different examples today to try to make it more relevant for you all. If you're a little confused about the chat and the questions, you are not alone. Alejandra just coached me through how to use these effectively. So, but you will find that I ask a lot of questions throughout the presentation. This is not as just like a sit back and relax type of presentation like some are. I really do try to keep people engaged by asking lots of questions and to be thinking about things. It also helps me stay more engaged and, and be able to tailor responses or that information to better meet your all's needs. So, okay, so some of you are saying, some of you see it, some of you don't. If you look in that control panel, there should be a chat box, and that's where some of the questions are posted. I'm not going to be typing in there throughout the rest of the presentation, but if you can find it, you can see some of the things, but I'm just going to be saying everything else. And if you can find the questions placed, that's where you're going to respond. So let me read through just a couple more of these, and then we'll get going.
Yeah, and so for new arrivals, I just resent those questions in the chat box. So again, review the questions and then type your response under the questions box.
All right, yeah, so once again, just validating that we've got a really wide variety of folks here. So just a little bit about myself. So my name is Kyle Davis. I'm a clinical psychologist. I've been in Idaho since 2013, licensed in 2014. I do a lot of work with health behavior change currently. I work half-time with St. Luke's Department of Lifestyle Medicine, where everything we do is trying to help people live healthier lifestyles. And then I also have an insomnia clinic that I'm doing in private practice currently. So I spend a lot of time helping people sleep better and then exercise more, eat better, manage stress. Yeah, so all that kind of stuff. So more general lifestyle kind of behavior. Yeah, but one of the beauties of motivational interviewing is the same type of way of communicating with people applies to whatever you're trying to help them with. And so, yeah, we've got a lot more to learn today. All right, so I've got this presentation broken into 8 different parts. We do have 2 hours scheduled today, so it's a pretty long presentation, and there's a lot of material. So I move pretty quickly. And I'm not sure, maybe we'll take a very short break around 11 just to give people a chance to stretch their legs. I'll probably ask the group around that time to see if people, want that break or not. So, all right, so part 1 of the presentation today, I want to cover like what motivational interviewing is and how it came to be. It's kind of interesting. Well, like I guess many things in healthcare, we kind of stumbled upon motivational interviewing more than we had this like very clear objective of what we were trying to do whenever it was developed. Or I'm saying we, but it was actually the authors here. Bill Miller was the lead author behind that original study. So I'll also throw this out there that if anyone is looking for other resources to learn more about motivational interviewing, this is like the Bible of motivational interviewing on the screen here. They may even have a newer edition since I made these slides. There's also a shorter book called Motivational Interviewing in Healthcare. If you work in a healthcare setting and you're helping people change behaviors related to their physical health, I highly recommend that book too. So just wanted to be clear off the bat that this is not, my own material, something I developed. Is just something I've learned and love helping other people understand so that they can help more people themselves. All right, so I like starting off this whole presentation with an example of what motivational interviewing is not. And Alejandra didn't know that I may be putting her on the spot today. Alejandra, would you be willing to be my my peer example for this exercise?
Sure, let's do it.
Okay, thanks. So a little bit of background here. Let's say I'm a peer support specialist and I want to help my peer Alejandra cope with her symptoms of depression and avoid losing her rental. So And what I want you to do is monitor your reaction to this conversation. Put yourself in Alejandra's shoes and see how you would feel if you were in that situation. So, all right, here we go. So, Alejandra, I heard that you've been having a hard time with your mood, and that's affecting your ability to work. And now you're worried about losing your rental. I wanted to let you know that I've been in your shoes before, and I've got a really good idea about what I think could help you out. First off, we've got to get your mood under control. The kinds of things that have helped me: exercise, social interaction. And I think you probably need to start taking your medications again if you've stopped using those. And if you do all that kind of stuff, that should really help you with your mood. And then we've got to get you back to work. So what do you think about all that, Alejandra?
Am I responding as if I'm the actual person, or am I just giving general feedback?
As the peer that I'm helping right now.
Beautiful. Okay. Thank you for sharing all of that. I know that when I'm experiencing my episodes of depression, that doing all of those things is, can make it increasingly difficult. So I appreciate all those recommendations, and I'll try my best. It's just a little bit harder to get the process going.
Okay, and so I'm not going to belabor that any more here. People probably already have their reactions figured out here. So now, Alejandra, in terms of giving feedback, how did that make you feel whenever I was telling you all those things? I'm curious, like, what kinds of thoughts were going through your mind, why, or when I'm telling you exactly what you need to do. And I also want everyone in our class today use that questions box and tell me how you felt or how you think you would feel if you were in Alejandra's situation with me telling her exactly what she needs to do to manage her depression and not lose her job and her apartment.
Yeah, so for me, I felt like the position of being in that position of, I'm going to lose my job, lose my housing, some basic human needs, that in itself is already stressful, and especially experiencing depression. And so I felt like your response was very direct, very, 1 + 1 = 2. This is all you have to do, and everybody across the board is the same. And I mean, it's just easy. That's all you have to do. Didn't really feel like you were listening to where I was at and the catered needs that I needed.
Yeah, so I love reading the responses here. First one: not heard or understood, frustrated, ignored, defensive, I don't feel motivated, you don't understand me, you're just telling me what to do, I feel overwhelmed. Yeah, so if you had like a cringy kind of response to that, that's what I was going for. And unfortunately, I feel like that happens a lot in healthcare. It's easy to kind of just go into your script and tell people what they need to do. Chances are, you do have a fair amount of insight into what's going to be helpful for somebody. But presenting the information in that kind of way just is usually not all that helpful, as you all are saying here. Like, I'm the expert, you're the dummy. If it was that easy, yeah, people would have done it already, right? So yeah, once again, you all are right with me here. I'm not saying that that's what I want anyone to be doing. So let's flip it and try something a little bit different. So now I'm going to model some skills for motivational interviewing. And once again, I want y'all to monitor your reactions here. And then hopefully Alejandra is still willing to work with me on my example. And this is Kyle 2.0. This is motivational interviewing, Kyle, not assessment-oriented, judgmental. I'll tell you exactly what you need to do, Kyle. So different version here. So Alejandra, I heard that you've been having a hard time with your mood, and then that's been affecting your ability to work. and it also sounds like it could be affecting your ability to pay rent. I was wondering if you could just tell me a little bit more about, your take on what's been going on.
Yeah, so I don't know. I just feel like the weather's been changing, and that automatically just puts me in a lower place, and I don't have as much motivation to even address all of these things. It feels like it's a big cloud. It's big picture things. Like I could lose my housing, and I don't even really know where to start. I feel stuck.
Yeah, it can feel kind of like paralyzing, like whenever your mood takes a turn for a worse and you just don't know where to start. Um, I'm curious if you've been in a place like this before in terms of how you're feeling, and if there's anything that you found to be helpful for yourself when you've been in these kinds of situations, or when you're feeling like this.
hmm Yeah, so like when I'm feeling depressed, or if I've experienced like a potential like housing
Yeah,
issue.
well, I'm curious about both, but it probably makes sense, to talk about your mood first. It's going to be hard to do any of those things that'll help you get to where you want to be if your mood stays where it is. So, what do you think would be helpful for you, or what has been helpful for you in the past in terms of your mood?
Yeah, so for me, I'm a big and within my culture, it's really big to have like that family support. And so that's something that always lifts my spirits is, when I'm with my family.
Okay, yeah, I'm curious. I have you been spending much time with your family recently?
No, we've been, of course, taking this whole COVID thing very seriously. And so while emotionally it's been very difficult, I understand that it's um, for the for the betterment of everyone, but it still just doesn't make it easy that I can't see them.
Sure. Yeah, I know that's been a big stressor for a lot of people in COVID, just not being able to spend or be close, physically close to the people that they want to be with. I'm curious, in considering those circumstances, and how important your family is to you. Do you think there's any way that you could spend more time with them now, and like, what would that be like?
Yeah. So thankfully, with technology, we've been able to connect in that way, um, and scheduling like weekly Zoom calls, and doing virtual activities like taking virtual cooking classes together, um, and trying to find creative ways of still exploring different activities with one another.
Yeah, that's awesome. So I'm going to break out of my character here, and I am curious, well, from everybody's perspective here, and then as well as Alejandra's, how did that feel different this time around?
I felt like you gave me control of the conversation, and I felt like with you saying I'm curious, and coming into it with a curious mind rather than I already know your situation, just automatically put me in a place where I felt like I could be more vulnerable and honest about where I'm at.
Okay, great. Yeah, that was certainly my intention. And now it looks like people are chiming in here. Yeah, people are liking that I asked you questions. They felt like it was more understanding, more caring. Yeah, I'm focusing on her strengths. I'm focusing in on, yeah, what's worked for her in the past. I think in this kind of perspective, I am assuming that every person I'm trying to help is they're the own expert on themselves. They know themselves better than than certainly I know them. And so I want to use their own knowledge about themselves to help themselves. And I can use the way that I am talking to them to help guide them towards what's going to be helpful for them. And that's really kind of at the essence of motivational interviewing. It's all about getting people to figure out their own reasons to change, their own plans for change, and we just help guide them to get to where they want to be. So, even like this initial reaction here just feels way better, which honestly is another thing that I love about motivational interviewing is it feels good as the peer or provider, and then it also feels way better for the patient. Like I use patient because that's the setting I'm used to working in. But yeah, your peer or patient or whoever your client, whoever you're trying to help. All right, so what is motivational interviewing? And I've got this little cartoon here because I always found it kind of funny because whenever I have worked in these different healthcare settings, providers would basically say, okay, we've got a psychologist now, fix this person, fix their depression, fix their anxiety, fix their substance use problem, fix their weight, fix their diabetes management. Can you just talk to them and fix them? And that is not what motivational interviewing is all about. So it's just a little curious situation that I've found myself in many times. So technically, motivational interviewing is a collaborative, goal-oriented style of communication that really focuses in on the language of change. It's all about getting people to talk about why they want to change and why they would be or how they would go about changing on whatever it is that they're working on. It really focuses on helping people strengthen their own personal motivation for and commitment to achieving specific goals by getting them to talk about their own reasons for change. And then I'm providing an atmosphere of acceptance and compassion. And once again, that just feels good to me as a human being and a therapist. And I'm guessing it does for you all too. That's how we like to operate. And it's just a really nice way of going about trying to help people. But motivational interviewing is a little bit more complicated than it seems because there are so many nuances in the way that we are used to communicating with each other, and some of them are more helpful than others. So we're going to really hone in on those different factors today. So we can think about motivational interviewing as having four main processes, and that's basically how our presentation is broke down today. First up, we've got to engage with the people that we're working with. We've got to develop a relationship with them in order to be able to continue helping them. Next up, we've got to figure out what exactly we are trying to help them with. So focusing is a really important thing because we don't, and maybe you felt this way before, it's like there are so many things that I could potentially help this person with, and they're not totally sure about what they want the most help with. I'm not totally sure about what I could help them with the most. And so we want to pay particular attention to this focusing concept so that we can be really intentional about what we're trying to help people with. And then next up, once we figured out the area that we want to try to help them with, we've established a relationship, we get to the evoking stage. And evoking is all about getting people to express their own reasons and plans for change. So I'm literally trying to evoke that information from them. Just like with Alejandra, when I was asking her about what has been helpful for her in the past and what she thinks she could do in the future to feel better. That's really a great example of evoking. And then finally, once they're talking about what they want to do, then we help them plan exactly what they're going to do. All right, so let's talk a little bit about the history of motivational interviewing. Like I was saying a second ago, we kind of stumbled across what motivational interviewing or how it can be helpful. So it originally came about in 1983. It's as old as me, as an intervention for alcohol dependence. And what was going on in this particular study is these psychologists down at the University of New Mexico, Bill Miller, had put together this intervention for people abusing alcohol. And so they've got this fancy therapeutic intervention. And then in the control group, basically what they did was present objective information to the control group about how their drinking habits compared to the general public and how it was affecting their physical health. So basically, it's like you go in, you meet with somebody and they say, hey, it looks like you're drinking X number of drinks per week. That would put you in the top 5% of people using alcohol. People that use alcohol this much, can run into these particular kinds of problems. When we look at your labs, we see that you're having, so we see some elevations, that could cause you trouble down the road. And that was basically the intervention, provide objective information about what was going on for people in a non-judgmental kind of way, just providing them with the facts about what was going on. And what they found in the study is that the control group did just as well as the intervention group that got the fancy therapeutic intervention. So instead of saying, well, this is just a wash, people just get better on their own, we know that that's not true. And so what they determined was, hey, we may be onto something here. Just presenting this information in an objective way, non-judgmentally, actually had a big impact on people's drinking behavior. And so that's how motivational interviewing got started. And then it has been studied and studied and studied ever since to figure out exactly how we can take advantage of some of the aspects of that original study to continue to help people change behavior. So really, motivational interviewing is relevant in any sort of situation, where you're trying to help people change a behavior, very established in healthcare settings. And it also could be, we had somebody, saying they work at BSU earlier and help kids or college students, achieve, so we know motivational interviewing can be helpful in promoting study habits, everything from getting people to floss more to better managing diabetes. So it's a really wide-ranging type of intervention. Motivational interviewing is not based on stages of change or the trans-theoretical model of behavior change, but it maps on really nicely to it. And I think it can be helpful for people to have this in the back of their mind in terms of whenever they're working with somebody and they're trying to help them, to think about stages of change in this way. I'm curious, how many of you have seen this model before? Okay, good. A lot of you have. Perfect. Yeah, so this will be a little bit of a review for you all. So what stages of change theory says is that before we decide to change any behavior, we are in the pre-contemplation stage. So this means that it's just not on your radar at all. And this was originally developed in regards to tobacco cessation. So I'll use that as my example here. So let's say, that I'm smoking, and smoking's great. I'm not thinking about changing it at all. I'm just thinking about when I'm going to smoke my next cigarette. Well, then let's say, you know what, I'm starting to getting a little concerned about my smoking. I've noticed I'm coughing more. I'm not feeling quite as good as I used to. I'm spending quite a bit of money. And so now I'm thinking, I wonder if I could change this somehow. So now I've entered the contemplation stage of change. I'm aware that there could be a problem here, and I'm starting to think about changing it, but I've got no plan to do so yet. And then I start thinking more about, you know what, well, I've heard, that people can cut back slowly. They could go cold turkey. They could use the patch. They could use chewing gum. So there are different ways that I could go about reducing my use of tobacco. So now I'm in the preparation stage. I'm thinking about what I could be doing. And then as soon as I start taking action, trying to cut back, I'm in the action stage. So now I'm doing something differently than I was doing before. And then after I've been keeping that action up, then I hit the maintenance phase. So, the specific timeline of how long you maintain an action to enter maintenance is probably a little bit arbitrary, but we'd say, after several months of doing something, that different, you would probably be in the maintenance stage. And then for many things, we will relapse at a certain point. In the tobacco example, that could be using, well, tobacco again. In other types of things, like I help people change eating behaviors. They were doing really good on eating plant-based meals, but they found themselves at a buffet and they ate some brisket or something. So that person relapsed in terms of eating meat. So people will fall back into old patterns of behavior. And one of the main ideas is that we want to get them back on track with whatever they're working with as soon as possible. But anyways, the main point of me showing you this was that people just go through a pretty predictable steps whenever they are changing behavior. And we always want to be thinking about, well, where is this person in stages of change theory? And my goal is to help them level up. Move up to the next stage of change. So if they're in pre-contemplation, I want to plant a seed and get them thinking about it. If they're in the contemplation stage, I want to help them move to preparation. If they're already thinking about it, I want to help them take action and then move into maintenance. And if they do relapse, I want to help them get back where they were as soon as they can. One little caveat here that this image doesn't explain well is that if you relapse, you don't have to go back to pre-contemplation. You can go straight back to action and fall back into maintenance. And of course, that's our goal, is to help minimize the length of relapse for any unhelpful behavior. Any questions about stages of change? Sounds like many of you have seen this before, so I think that probably makes sense to you. And it looks like several of you also work with substance use or people dealing with substance use. So yeah, very relevant for you all. Okay, so let's talk a little bit about behavior change in healthcare. This may be different than the settings you're in, hopefully, but it's still pretty darn common. So how do healthcare providers, peers, friends, family members help other people change behavior? Well, like you saw me doing earlier with Alejandra, there's a very strong urge to give advice. And so that's a really typical way people go about doing things. Maybe we take a stronger tone and we're giving them orders depending on the dynamics of the situation. Maybe I'm like giving them lots of information or handouts and say, oh, you just need this handout. Hopefully that will help. And then sometimes people are scaring them like, hey, if you don't do this, then this terrible thing's going to happen. And then this bad thing's going to happen. And you're going to wish you listened to me. And then sometimes, people just like go the other end of the spectrum and they provide empathy and support, but they're not necessarily helping them come up with specific plans to do anything different. They're just, providing that empathy. So these are really common ways that we would go about helping people. And, while sometimes effective, maybe there's some room for improvement here. So I'm curious, what strategies have you all used to help people change behavior in the past? What have you found effective? And don't just say motivational interviewing. Oh, Bradley, I think you probably typed that before I said that. Oh, some really good examples here. So people are talking about listening, giving them tasks, and then seeing how they do with them, helping them troubleshoot that. So like I was doing with Alejandra, asking them like how they've done different things before, and then help them apply those same things to what they're working on currently, focusing on building the relationship. Yeah, getting them to think more objectively about what they're doing and how it's helping them. Yeah, and just kind of backing up and looking at things more objectively, helping them look at themselves more objectively. And then they made it, I like what Amy's saying here, like just pointing out that they don't have to do something like, hey, this is a choice you can make. You don't necessarily have to do this. And then when you turn the tables a little bit, they're like, oh, well, you know what, maybe I do really want to do that. And as soon as we take the pressure off of them and people have room to do things for their own reasons, that's oftentimes where you're going to see the behavior change. Yeah, so everything from, some of our core motivational interviewing skills, relationship building, asking questions, giving small assignments for people to work on and getting feedback here. Yeah, a lot of this kind of focuses on non-judgmental, objective ways of looking at what the person's been doing and what could be helpful for them. That's awesome. So follow-up question to that, now that you're thinking about how you have helped people in the past, what do you think were the most important factors in helping that person change a behavior? Okay, so people are saying the relationship, giving them choices, accountability, follow-up. I really like what Jennifer said here, initial desire to change. And then, yeah, providing follow-up to that. Okay, yeah, so you all are definitely all over the communication skills side of this and building relationships. That's what I would expect from a group like this. Okay, but when we think broadly about why people change behavior, it has to be important to them for some reason. And that's why I was really honing in on Jennifer's response there. So people change behavior when they're intrinsically motivated to change the behavior. So they are changing the behavior because it helps them feel better. It's satisfying to them to engage in the behavior. People also change behavior for extrinsic motivation. They're changing their behavior to obtain something outside of themselves or avoid something negative from happening to them. And so whatever they're working on has to be important to them for some reason, and they have to have confidence in their ability to change that behavior. So the fancier word for that is self-efficacy. We want them to have confidence or self-efficacy. We want them to understand how they can do it. So it has to be important, and they have to have confidence in their ability to do it. And as peers, healthcare providers, support people, we can help them figure out why behavior change is important to them, and we can also help them develop the confidence to change that behavior once they know why it's important to them. So one quick slide here again about what motivational interviewing is not, because this is really important, like when you're thinking, wrapping your head around how you're going to use this. Motivational interviewing is not reverse psychology. It's not something that we apply to people to make them do what we want them to do. It's everything to do with your intention about helping them, and so there's like a sincerity involved in motivational interviewing that I think can get overlooked sometimes, especially in healthcare settings, because people are just like, well, I just need them to do this. What do I need to do to make them change the behavior? What do I do to make them change their medication? And so you see people that will apply these skills without necessarily caring. And that is such a crucial element of the spirit of motivational interviewing. I think in a group like this, almost everybody here probably just truly, sincerely cares about helping the people that they're working with. And so sometimes we could take that for granted, but it's so important that we have that in the back of our minds, that I'm just not going to apply this to try to make them do something. I really want to help people do things for their own reasons, and people will feel that whenever you're working with them. I think you all probably understand that it's a hard thing to describe. Does that make sense to you all? You know what I'm talking about? maybe you've seen, people not so skillfully try to use some of this stuff, and you can tell that they don't really care. And yeah, does that feel different to you all? Okay, thank you for saying yes. Okay, so in motivational interviewing, we want to think about different types of conversation styles. So one type of conversation style is directing. This is like what I was doing to Alejandra earlier. I'm providing information, telling them what to do, giving advice. Another way of going about things would be following, where we just listen and just try to understand what others are saying, and we never insert our own thoughts. So that can be helpful in building the relationship, but it can also be hard to move forward in helping them change behavior if you just stay in that following kind of role. And so ideally, where we end up is in a guiding kind of role, where we are combining directive and following styles and using each style when appropriate. And that takes some skill to go back and forth between those things. And what we'll learn is you're basically seeing how people are responding to what you're saying to decide if you need to be in more of a directing or following kind of role. So you're kind of dancing back and forth in terms of how you're communicating with somebody based on how they're responding to you. All right, so moving on here. So we've got a big picture idea about what motivational interviewing is. It's probably a little cloudy or vague right now about, well, what do you do? First step is engaging with our patients and listening. And we use our listening to help them feel engaged. So I'm giving away some of my answers here, but imagine that you're like in Alejandra's shoes earlier, or you're a peer, you're in the situation of the person that you would typically be helping. From that perspective, what kind of factors would help you feel engaged with the person helping you? Okay, listening. Yeah, unconditional positive regard. Michelle and Bradley are on the same page here. Yeah, providing empathy. Yeah, but just literally paying attention to them, looking at them, putting the phones down. Yeah, reading body language. You'll know that they're listening to you if they're reflecting. Yeah, active listening skills. Yeah, they're kind of in that following kind of role, letting the person pick the pace or choose what they're talking about, set the agenda. Great, yeah, those are awesome examples. So from the peer perspective, people are usually thinking like, hey, do I feel respected by them? Do they care about me? Do they respect me as a human being? Are they listening to me and understanding me? Can I trust them? Or are they just trying to get information out of me? Do I have a say in what happens in our meeting? Yeah, you all are all over this question. So those are the kinds of things that help them feel engaged, and that's exactly what we want to take advantage of when we're working with them. I'm also curious, what do you all notice about peers engaged in their recovery? What would you notice in somebody that you know is going to do well? Yeah, they keep coming back. Yeah, like they actually do what you talk about, and then they come back and you talk about it. Yeah, so they're trying different things and reporting back on it. Yeah, they're engaged. Ooh, Bradley, I like that one. They identify personally significant reasons and motivation. Yeah, as we'll learn, change talk. Yeah, maybe they're taking small steps. They're talking about obstacles. They've got other support systems. They're setting goals. They're using the same kind of language that they're learning from you in treatment. Yeah, you can tell they're paying attention when they're learning or changing their vocabulary. Yeah, those are really, really good examples. Okay, so I think you all were covering this. So they, you've got a mutually trusting and respectful helping relationship. There's agreement on goals. You say, hey, I want to help you do this. And the person's like, yeah, I want to do that. So you're agreeing on the same things. And then you're working together to develop tasks to reach those goals or the steps to make it happen. So you're coming up with a plan, they're executing it, and then they're reporting back to you. So yeah, those are all excellent examples. So let's talk about some things that can lead to peer disengagement. So assessment-oriented conversation, just asking a million questions, especially closed questions. Taking an expert role on prescribing change and saying, hey, I know what your problem is and this is what you need to do. Premature focus. Sometimes, people will kind of cue in on one particular thing that they think they could help the person with, or that they think is responsible for a lot of their problems. And that may not be what the person is interested in changing. And so we've got to watch out for looking for things that we could help with, but may not necessarily be the most important thing for that person to be working on. Just because you can help somebody with something doesn't mean that that's what they want to be working on. Labeling, so just writing people off and saying, oh, well, that's just this kind of thing, or you're just that kind of person. That's certainly not helpful. And obviously blaming or telling people, hey, it's your fault that this happened. That may be true, but it's not going to help anything in terms of building your relationship. Making small talk. A lot of people kind of have a nervous habit of making small talk about things. And if that goes on for too long, it can prevent you from being able to get to more important kinds of things. All right, so you all were talking about listening earlier and how important that is. I'm mindful of the time here, so I'm not going to ask questions for all of these things because you were all already kind of describing this earlier. But how would you know if somebody was listening to you? And then how would you know if you're listening to somebody else? So usually we know that somebody is listening to you if they're able to repeat back to you what you were saying. They can explain it. They're using the same language that you're using. So we had some of those examples. And how do you know if you're listening to someone else? Well, it's the same thing. If you can expand upon what they're talking about, you can talk about why it's relevant to them, then you would have a good understanding of what they were bringing to you. So one of the kind of bread and butter skills of motivational interviewing is reflective listening. People that have helper kind of backgrounds, therapy kind of backgrounds are usually really good at reflective listening. So I'm assuming that most of you all are really good at this already, which is awesome. So let's talk a little bit about different types of reflective listening. So the essence of reflective listening is responding to someone and you're kind of making a guess at what that person means. This could be as simple as repeating back to them what they're saying, or it could be more of a complex reflection where you are trying to make connections between other things that you know about what the person has said. It basically demonstrates that you are really listening to them and trying to apply what they're talking about to the problems that they may be having. So a really interesting fact about motivational interviewing is for people that are really skillful in motivational interviewing, they are making 2 to 3 reflections for every question they ask. So they're basically using their reflections to get more information from the people they're working with and to get them to expand upon what they're trying to do. Where in a typical setting, questions typically outnumber reflections 10 to 1. So we have a tendency to ask tons of questions and not make nearly as many reflections. So if you want to become more skillful at motivational interviewing, really think about how you can make reflections to get people to talk more, basically instead of questions. You can use reflections in place of questions, and then that's going to really help people feel more understood, and you can get probably the same amount of information from them that way. It's just a little bit more difficult to get into the habit of doing. All right, so let's think about some of our, now that we're focusing on building the relationship, we're still in the engagement phase. Now we're thinking about some of our other skills and values. I love talking about values, and this is so important whenever you're trying to help people change behavior. So our core interviewing skills, and I was thinking about this before the class today. Interviewing skills, these are like, they're core motivational interviewing skills, but they're also just core like conversation skills. So first up here, and also we have the acronym ORS to remember this, and that's why I put some ORS up there. So first up, open-ended questions. So we'll talk more about that in just a second. Affirmations, or making affirming statements. Reflecting, like we were just talking about in our listening section. And then making summary statements. So we've got our ORS here, and we really want to be focusing on these skills throughout motivational interviewing, whether we're building our relationship, we're helping people talk about change. I used this term a second ago. Our bread and butter are these ORS skills because we keep coming back to them because they are really going to help us help the people we're working with come up for reasons for change. So open-ended questions. So what do you all think the benefits of asking open-ended questions versus closed questions would be? And we can also say open-ended questions are just questions that you cannot give a yes or no answer to. Closed questions are yes or no kinds of responses. So what do you all think the benefits of asking open-ended questions would be? Yeah, people are reflecting more on themselves. They have to think about things for their own reasons. So you're going to get more specific examples when you ask open-ended questions. Yeah, you're allowing them to take the lead and focus in on what they want to be talking about. You get more information. They're more involved. Whenever I was putting this presentation together, I had just been to the dentist, and I was really reflecting on motivational interviewing. And whenever I sat down, I just got hammered with a bunch of closed questions. Like, do you floss regularly? Do you brush regularly? Do you have any problems? You know, just like boom, boom, boom. And I felt so disengaged from that. And of course, I mean, I was making a motivational interviewing presentation at the time, so it's at the top of my mind. I'm like, why didn't they just ask me, like, how is dental hygiene going for you? They could have got all the same information, and then I would have felt respected and engaged, but that just wasn't the norm. I think you all did a really good job of explaining, you know, why open-ended questions are so helpful. Have any of you all had those experiences before with closed questions, and you could just know that you just feel like disengaged right off the bat, and it makes you less likely to share more information? Michelle's like, yeah, that's what happens in the medical system. Yeah, unfortunately, in a lot of different medical settings. Okay, so just like you all are saying here, open-ended questions invite a person to think about, think before responding. That is going to allow them to express themselves, and it can give you so much more information about them, and ultimately help you get to know them better. And just like we were saying, closed questions can really disengage the person, and you're not going to get nearly as much information from them if they can answer with a yes or no. So if people are feeling anxious, shy, frustrated, you know, they are already going to want to use like closed responses, and we can get them more engaged by using open-ended questions. All right, so I'm guessing you all are already good at using open-ended questions. Next up, we've got affirmations. Affirmations are I always laugh when I give this presentation because when I get to this point, I recognize that I've been giving lots of affirmations. So affirmations recognize and acknowledge that which is good, including the individual's inherent worth as a fellow human being. Affirmations provide support and encouragement. And I just did this. Good affirmations are different than praising and typically start with you and not I. And I love that because, so just like I was saying to you all, like you all are giving me great examples right now. That's different than saying like, I think you all are doing a good job right now. Like where I'm like passing judgment on you in some way. And so it's a little nuanced thing that feels quite a bit different. And so whenever you're making affirmations, just saying you are doing this versus I think you're doing this can be really, can be more encouraging for people. All right, and then finally here for our OR skills, we have summary statements. Summaries are really just reflections that pull together several statements somebody has made. So whenever you use summary statements, you can do this to really focus in on somebody's strengths, and you get to choose what parts of the conversation you want to highlight. So this it sounds simple, but can be kind of complex because you're really trying to take all the information and make a choice about what you're going to present back to them. And that could be more or less helpful depending on what you choose to present back to them. Another thing that happens when you make summary statements, it's going to allow the other person to hear their experience in an objective kind of way. And maybe when you do that, they'll see things differently than they did before. You know, we get so stuck in our heads and thinking about things the same way that having somebody else present the same information to you in a slightly different, more objective kind of way can be really helpful in getting a different take on things. So that's something that we can do for the people that we're trying to help. And summary statements you can use it to collect different types of information. You can connect them from different things that the person is working on, or you can use it to transition into a different part of your conversation. That's a little nerdy. Okay, and now values and goals. So understanding someone's values and goals is essential to really getting to know them. Because guess what? People are often living inconsistently with their values and long-term goals. How do you think people feel when they're living inconsistently with what's really important to them? How does it make them feel? Chaotic, I like that. Yeah, it leads to anxiety. It leads to cognitive dissonance. You know, yeah, so you are really nailing this. Okay, anxious, stressed, low self-esteem, regretful, maybe depressed. You know, so oftentimes when people are experiencing, you know, these common symptoms of stress or mental health conditions, they are living inconsistently with what's important to them. And if we can help understand what's really important to somebody in their lives, then that can help us get them back on track with what's important to them. So we call this like developing discrepancy. So we want to be thinking about, well, what's really important to this person? How are they living their lives? And are there any discrepancies between what they're doing and how they're living? And the truth is, you know, all of us are going to have discrepancies in our lives at some point in time. That's normal. But when we have really large discrepancies, you know, that's when people are starting to suffer more and where we can potentially help them more. So I think what we'll do here, I'm gonna just to make a point out of this, let's do a little values exercise. Maybe we'll take a short break, just like 3 or 4 minutes, and then we'll come back. And I just want to see how this hits you all. So imagine yourself 20 years from now, and you're looking back at your life, and I'm curious to know, what do you want to be remembered for? What are some of the most important aspects of your life? And it can be helpful to take this future-oriented perspective, looking back and saying, what was really important to me? What do you want to be remembered for? And after you identify a few of the things that you want to be remembered for, think about what you are currently doing in your life that is consistent with that, and maybe some things that you're doing that are inconsistent with that. So as part of our break here, you get a glass of water, go to the bathroom or something, be thinking about your future self, looking back at your life, what's really important to you, and what are you doing that's consistent or inconsistent with what's important to you. I know that's a heavy question, but we'll just, we'll get some idea, or I'd love to hear your thoughts about this. And we'll get started again at 11:05. I'm gonna leave everything up, but I'll be back in just a couple minutes. All right, looks like we just hit 11:05. We got a few responses in the chat box before people left. And I love reading about people's values. You can imagine that this is actually probably one of my favorite questions to ask people, just as a psychologist, a therapist. I like getting to know people. And yeah, this is, you can cut straight straight to the core by asking these kinds of questions. I love these answers. So yeah, so I'm curious, anyone else want to chime in about the things that are really important to them in their lives or their values, and then any other comments about what they're, how they're living consistently or inconsistently with what's important to them. Yeah, so we could probably goes without saying here that everybody is in a position where they are trying to help people do something or other. And I mean, even just coming to our training today means that you are invested in trying to improve your skills so you can do even a better job of helping the people that you're working with. So that's one example of how you're living your life consistently with what's important to you. We had some other really great examples from what people were saying in terms of, the type of work they do and how they, go about trying to help people and how that's, really important to them. And sorry, I'm reading through these. Yeah, people mainly were talking about some of these, or caring about helping people. I realize this is a pretty private question, but oftentimes when we ask this, people think about their families, setting examples for other people, their relationships. Maybe you're thinking about your health, and how you can or manage your own health, as well as set examples for people you care about in terms of managing your health. And another one, the reason I'm running through some of these really common ones is because inevitably the people you're working with are going to have the same types of values. Another one that can be super helpful that we can take advantage of when you're trying to help people is almost everyone is going to have a desire for independence. Whether that's doing things on their own, living independently for as long as possible. That's something that most people care about, and you may be able to help them or tap into that whenever you're helping them, kind of figure out how they maybe want to be doing things differently in the future. So remember, well, also I'm just curious, what was it like for people to think about your own values or what's important to you? Is that something you feel like you take time to do, or is that something that kind of gets pushed to the wayside? Yeah, I think that's normal. I mean, we just get so busy. People get on autopilot, and you just do what you do, and it can be so helpful to just take a step back and think about what's important to you, and then check in with yourself, about how you're living your life. I'm curious, do we have any acceptance and commitment therapy fans in here? Any ACTI people? So if you like thinking about values and living your life in accordance with your values, highly recommend looking into acceptance and commitment therapy. Oh, yeah. Trying to remember the name of this book really quick. I always forget. It's on my bookshelf. I'm sorry. I love this book so much that I want to throw it out there for you all. Yes. I always forget that part. I'm typing it in the questions box here. Oh, weird. I just was like over somebody's response, and so it looked like a reply. But it's called, or Steve Hayes is the author, A Liberated Mind, How to Pivot Towards What Matters is the name of the book. So yeah, he's the originator of acceptance and commitment therapy. If you're interested in motivational interviewing, you probably will really like acceptance and commitment therapy too. It can be really helpful in thinking about managing your own life and helping other people too. All right, back to motivational interviewing. So now that we are engaged with our peers, we've got a solid relationship. We're using our OR skills to facilitate that relationship. We want to move on, and we really want to start focusing on what we're going to try to help them with. So like we were saying earlier, there can be a lot of different things that you could potentially help someone with. And maybe you've been in a situation before where you start helping them with something and then you get sidetracked, and then you help them with something else and you get sidetracked, and you focus on something else, and you never feel like you're really making the kind of progress that you want because there's always some fire to put out, and that's where you're focusing. And so once again, it can be helpful to take a step back and think about, what am I really trying to help this person with, and how can we make progress in this area when there is all this other stuff going on? What's going to be the most helpful thing for this person in the long run? Sometimes that focus is very clear. Other times it can be pretty difficult, depending on how much chaos that person is experiencing. So sources of focus. Your peer is, or the person you're working with, is a great place to start. What are they bringing to you? What are they telling you that they want help with? The setting, maybe you work in a very particular kind of setting, and that's going to tell you a lot about what you help people with. So like in my insomnia clinic, they're probably having problems with sleep, right? And so if you're in a residential substance abuse treatment setting, obviously you're probably helping people with substance abuse. So setting can be an important source of information. And then your clinical expertise also plays a role here. You may have be able to see things more objectively than that individual can, and so don't overlook your own knowledge about what could be going on here. But we have to be careful about just assuming that we're right. So I guess that's the balance. You want to have your own expertise and bring that to the situation. And we also have to be mindful that we may be wrong. So we got to stay humble. Okay, so once again, there could be like a really clear single direction. There could be several different directions you could go. Or if you can't figure it out, it's worthwhile to try to figure out what's really important to that person before moving on, because you just don't want to be like a pinball bouncing around, and just trying to meet the patient person wherever they're at. You can help them out more by being a little bit more focused. So you may be wondering, well, sometimes the people I work with, they have no idea what they want to work with. There's so many different things that they could be doing. How do you go about doing this? So an important strategy could be what we call agenda mapping. So this is where you take a step back, you consider all the potential options, and then you work together to choose what direction you want to go in. So I would literally start writing this stuff out and say, hey, you've got, you're worried about this, you're worried about that, you're having problems with this. Maybe it's your depression, maybe it's drinking, maybe it's housing, maybe it's relationships with friends or family. Let's write all these things out and then put them on a list, and then ask the individual, what do you think would be most helpful to you right now? I want to help you with whatever is most important for you. Let's get that out, and let's start making a plan to help you with it. Okay, and so after you have chosen a direction to work in or that you want to help people with, then we start getting into the situation where we're going to be exchanging information. There's some really common traps or patterns that people fall into, and there are some alternative ways of doing things that can be more helpful in the long run. So common traps are assuming that you're the expert on why and how this person should change. Got to watch out. Anytime you're feeling self-righteous, that could be a clue to take a step back. So in contrast, thinking about yourself as having some expertise, but each individual is the expert on themselves. I'm just here to help them. 2, common trap. I just need to collect more information about their problems, versus I find out what information this person wants and needs. It's not my job just to figure out everything. I'm going to help them with what's most important to them. Common trap. I just need to fill in their gaps in knowledge. They just need more information about how to deal with this. I've got the perfect handout for them. And in contrast again, I'm going to match information to what this person wants and needs and their strengths. I'm not just going to give everybody the same thing. I'm going to try to focus in on what's going to be most helpful for them. Another trap would be, I just need to scare them into making a change. If they only knew how scary this was, then they would change. And in contrast, this person can tell me what's going to be helpful for them. It's not my job to figure that out. Like, they can tell me what they need from me, and then I can give them that. And number 5, I just need to tell them more clearly what to do. Like, can I articulate this more clearly? And I'm just saying the same thing over and over again, versus I'm going to give advice that the person wants from me, and that honors their autonomy along the way. So I'm not just saying, hey, this is what you need to do. I've worked with lots of people in your situation before. We say, hey, this is what I could potentially offer you. What do you think would be most helpful for you right now? Okay, so another way of thinking about this can be like a specific skill you can use to exchange information is this elicit, provide, elicit. And what we're trying to do, or the way to think about this is we want to figure out what the person knows, what they want, and what we can potentially do to help them. And then we want to see what their understanding of that information was. So if I'm trying to help somebody, let's say I'm meeting with somebody who is trying to cut back on drinking. I may say, hey, I'm really curious, what have you learned about, long-term effects of alcohol on people's health? What have you seen? What have you heard? I'm sincerely curious to know, like, what do you, what are your thoughts about that? And then, so they're telling me some things, that's giving me an idea of where I can potentially help them. And then I'm like, okay, well, it sounds like you've got a fair understanding. It sounds like there's some other stuff, that I'm familiar with that could be helpful for you if you wanted to know more about that. Do you want to know more about that? Do you want to know how other people, have had success in reducing their use of alcohol in our program? But we're asking. And if somebody says, no, I don't really care, I'm not ready for that, we say, okay, well, what else could we help you with? And if they say, yeah, well, that's why I'm here, I do want to know more about that. Well, now you've got permission. Now they are asking you to give them that information. And that really puts people in a different situation than you would have been in otherwise. You want them to be asking you for that information, because now you're working together. Instead of you telling them what to do, you're giving them the information that they wanted from you. And then after you tell them how you could potentially help them, or what you wanted to, or what you felt like they needed to know, then you say, so, what's your take on everything that I was just talking about? Does that change anything for you? And what do you think you want to do with that? So once again, this is elicit, provide, elicit. You're asking permission You're seeing if they want to know more. And if they want to know more, then you give them information and then you check back in with them to see what their take on it was. Because sometimes people are going to get different impressions about what the information you gave them, what you thought you were giving. So that's going to be a really important step. And once again, it just helps them feel more understood by you when you're asking them about it and you're being sincere through that whole process. All right, so now we are exchanging information. We are focused in on a specific thing that we're trying to help people with. And now we're kind of getting to the heart of motivational interviewing and if people or how we can help them change. So you are likely to start experiencing ambivalence at this point. Oops. Very sensitive mouse. So, well, what is ambivalence? So ambivalence can be defined as the state of having mixed feelings or contradictory ideas about something or someone. And I'm curious, what are some examples of ambivalence that you all run into and the people that you're working with? They're like, on one hand, I want to do this, but on the other hand, I really would like to keep doing what I'm doing. Yeah, what are some common examples of ambivalence in your settings? I'll tell you, so in my lifestyle medicine clinic, examples of ambivalence, people are considering exercising more, developing regular exercise plans. There's a strong desire for people to not do that. So on one hand, they know it would be better for them. On the other hand, it's a struggle to start literally putting or taking steps to make that happen. Same thing goes with changing diets. People are used to eating the same way through most of their lives, and they start thinking about doing it differently. There's a strong desire to keep doing things the same way that they have been doing for familiarity alone, just because it's hard to change something that you are so used to doing, like eating the same kinds of foods. Okay, now we've got some examples rolling in. People want to feel better, but yeah, not willing to exercise. Okay. Yeah, so they they know that cutting back on substances could be helpful, but they're also getting something out of it. They're scared of what will happen if they do cut back. They don't have that in their lives anymore. Probably one of the most familiar things in their lives. Not attending class, but wanting to get good grades. Like, I just want the grades. I don't necessarily want to go to class or put in the work. Oh, we've got such great examples here. Everything from academic settings to substance use settings or sobriety to helping families and kids. Yeah, parents deciding to begin a new behavioral technique with kids. Like, anytime you try something new with kids, there's probably going to be some resistance there. And you've got to, be able to tolerate the resistance in order to change the behavior in the future. So yeah, ambivalence, these are like scales. Almost anything you're thinking about doing, there's going to be some ambivalence involved if it's a new thing. So ambivalence is everywhere, and what we want to do is help skip or tilt the scales in the direction of healthy behavior change, or whatever that would be in this situation. Yeah, so yeah, that's our goal. We help them resolve ambivalence about behavior change by getting them to talk about why they would want to do that or how that would help them live their lives more in accordance with what's really important to them. So change talk is the term that we use for this. Change talk is any self-expressed language that is an argument for change. Anything that's going to go on the scale to add up to them changing behavior, arguments for change, we call change talk. So there are two big types of change talk. There's preparatory change talk, where people are talking about why they need to change behavior, how they could change behavior, their reasons for changing, their needs to change, their desires, and then mobilizing change talk. This is when people are actually starting to do the work. So they are expressing statements that reflect commitment, activation, they're doing things, and then taking steps. So they're talking about what they're going to do. And, like most fields, we've got our own silly acronyms for these kinds of things. And we've got ours here is a darn cat. We're looking for darn cat types of statements that are reflecting change talk. And I want to get as much change talk as I possibly can from my patients, because I know that the more change talk that they are expressing, the more likely they are to change that behavior. And it can sound like a broken record sometimes, or I sound like a broken record, because I'm just like trying to get them to express more and more change talk, because again, that's what we know is predictive of behavior change. So what's our enemy here? Sustained talk. So sustained talk are the stated reasons not to change or to maintain the status quo. So if we are trying to get people to express more change talk, we are also, like, I usually not all that interested in getting them to talk more about why they would change or stay the same. Because I know that if they are expressing more and more sustained talk, then that's just going to make it more likely that they stay where they're at. So I really try hard, or I don't explore sustain that much, because I want to build the argument for the other side, or change. Once again, when you look at studies of motivational interviewing, you look at what people are literally saying that's predictive of their behavior change. It's associated with increased change talk. So people that are talking about cutting back on substances, people that are talking about why they should be going to class, people that are talking about why using different parenting skills would be helpful to them, those are the people that are going to be more likely to do it. The people that are saying why these things are not going to work for them or why they can't do it, that makes it a lot less likely that it's going to happen. All right, so how do you get people to talk about change talk? You can ask open-ended questions for which change talk is the answer. You can keep darn cat in mind and ask questions that address these areas. So I may ask, if I'm helping families with parenting skills, like, how do you think things could be different around the house? If this were effective for you, how would that affect your all's quality of life? How do you think you would be feeling differently if you were able to reduce your use of alcohol? How would that impact your life? How would that impact your relationships with other people? And when people respond to those questions, that's where you're going to get a lot of your change talk. We'll do an example in just a second. Okay, so different things that you can do to get change talk out of people would be ask about extremes. You say, you could ask them, like, what are the worst things that could happen if you stay on this course? What could happen to you? And where do you think you're going to be a few years from now if you stay on the same track? And that's going to be sad, potentially, but it's also going to get them thinking about how things could be different for them. You could ask them, or looking into the past and future, how do you think you would feel differently if you were doing this in the future? How did you feel in the past whenever you were living a healthier lifestyle? What was it like for you back then? Can you imagine feeling that way again now? Exploring goals and values. Once again, talking to people about what's really important to them in their lives, and how, when in the lifestyle medicine clinic, when we're talking about just basically improving people's overall health, I've got the luxury of anything that somebody that's important to them, having better health is going to allow them to do that to the way they want to be doing it, or reduce the amount of suffering that they're experiencing in their lives. So I could say, how do you, if you're spending time with your family is really important to you, how do you think having improved health is going to affect your ability to engage with your family 10 years from now? And somebody's like, well, I would be able to better play with my grandkids. I could get off the ground if I wanted to. Excuse me. Another strategy that people can use, this is what people probably remember more about motivational interviewing than anything else, is using these importance ruler or confidence ruler questions, where we ask people on a 0 to 10, how important would it be for you to change this behavior? And that is a nice little question to have in your back pocket. Because if I asked you all, we can probably all answer this one. How important is it to you to exercise regularly on a 0 to 10? We all have our numbers in mind, right? And then I say, well, why did you say that you were an X and not a lower number? So why did you say that you were a 5 and not a 3 or a 4? Whenever I ask that question, people are going to express their reasons for change. Does anyone use that question regularly now? The 0 to 10 questions? Yeah, this is just like such a helpful one to have in your back pocket. So anytime you're thinking about, asking somebody to change something, ask them why they are the number they said and not a lower number. Because what do you think would happen if I said, oh, why are you a 5 and not an 8? And in my exercise question here, what would happen if I asked you why you were a 5 and not an 8? Yeah, Jennifer, you're just reinforcing the lack of change. So if you ask somebody why they're a 5 and not an 8, they're going to tell you, well, I'm too busy. I've never been able to stick with a consistent exercise plan. They're going to give you sustained talk. So you've got to be careful when you ask these questions, and make sure that you're asking them in a way that you're going to get more change talk, so you don't inadvertently get sustained talk. And then you could also ask something like, well, let's say I'm trying to help somebody exercise more. How would exercising more affect your value of being a caring, compassionate person? And so we start trying to make connections between the behavior that we're trying to reinforce and what's important in that person's life. And maybe you would say something like, well, whenever I exercise more, it helps me better manage stress, and then I can be more present for the people I'm working with. And that's important to me. So you can start making connections between something that may not seem directly related to the other thing by asking these kinds of questions. All right, so let's say you've been using your skills here. You're getting a mix of change talk and sustained talk, and now you're saying, now what do I do? So whenever we're responding to change talk, well, let me check in with y'all. How would you know that somebody was using change talk? What would you notice about their statements? This is one of the acronyms I used earlier. How would you know that somebody was using change talk? There we go. Bradley, yeah, you got exactly what I was looking for. Darn cat. Other responses, looks like people are describing the same thing, but yeah, darn cat was the acronym. So people are expressing desire, ability, reasons, needs, commitment, activation, taking steps. So from what you've learned about motivational interviewing so far, if somebody is expressing change talk, what do you think your goal is in responding to them? What do you want to happen if you're getting change talk? What do you want from that person? You're going to use your words, your conversation to get more what? More of it. Yeah, we want more change talk. And what strategies do you think would be appropriate to get more change talk? Another one of our acronyms here. Mining it like it was a gold nugget. Yeah. I want as much of this as I can possibly get. I want all this change talk. Yeah, ORs. Yeah, good job, guys. So yeah, we want, we can use our ORs skills to get more change talk. So once again, I am mining the gold nuggets of change talk out of this, and I want as much as possible. I'm literally trying to tip the scales in the direction of change, and I want as much of that as I can get until I sound like a broken record. Okay, so I can ask more open-ended questions. I can make affirmations. I can make reflections. I can make summary statements. I want you all to give me examples of how you would respond to these different situations. Let's say, yeah, so give me your answers for both of my examples here. You're gonna make, how are you gonna respond to somebody who says, I really need to start taking my medication? So you've got one person saying that, and it's your job as a person trying to help them to get more change talk. What could you say to them? And then you also are working with somebody that says, you know what, exercising more would be good for my health. What could you say to that person to get more change talk? So we've got two examples here. Give me some examples of what you could say to them to get more change talk. Yeah, so maybe you make the reflection. You just say, well, yeah, taking your medication is important to you. And I say that in such a way that I'm like trying to get more information out of them. Maybe I could get even more examples. Maybe I'd say like, oh, okay, that's, you know, that's one of the first times I've heard you say that you really need to start taking medications. What changed for you? Maybe I ask like, what do you think taking your medications regularly would do for you? Yeah, so there we go. Like what benefits have you seen from using it? Tell me more about what is going on that you might, yeah, want to use them. Perfect. These are really good, good examples of reflections, open-ended questions. Yeah, and so, you know, so Lawrence's response here, like, does it make you feel better when you do? We're assuming it does, but that's a closed question. And so we may, you know, we can switch that slightly to say, how does exercise make you feel? You know, so we don't want to assume that it's going to make them feel better. We want them to say that because it's going to make it more likely. So once again, yes is not a change talk statement. I want them to give me more examples of change talk. Yeah, perfect, Lauren. Yeah, what kind of exercise do you enjoy? Yeah, so then you can get them thinking about commitment, activation, taking steps. Really nice responses, y'all. Okay, now what are we gonna do if we get sustained talk? Because this is gonna happen too. It's not all change talk. Even when you're giving it your best effort, you're still gonna get a lot of sustained talk in there. So what do we do when we are confronted with sustained talk? Well, I've got a whole bunch of different skills up my sleeve. I can use these straight reflections. And maybe somebody, let's say that the sustained talk is like, I just don't have time in my schedule to exercise right now. And I'd say, really sounds like you're just too busy to fit that in right now. And somebody gave me this example earlier. They were talking about like going to college. And you know, whenever you said, hey, you know what, college isn't for everybody, you know, that may not be the best fit for you. Ironically, like when you bring up something like that and you give them space, they may actually come up with an argument that they do want to do it, especially if they feel like they've been getting pushed really hard into that. So just making a simple reflection like, yeah, maybe now's not the best time for you to be exercising. You're likely to actually get change talk in response to that. But instead of trying to convince them of something, I let them come to that on their own terms. understand that some of these are kind of nuanced. These are not just like go-to strategies for every situation, but you can use a response like an amplified reflection, like, you know what, you're probably never going to have time to exercise. It's just not in the cards for you. So it's amplified, it's a little antagonistic, depending on your relationship, the situation, those could be helpful. They could also make things worse. You can do a double-sided reflection. You could state sustained talk and then state change talk. It's like you're having a really hard time finding a hard time making time for exercise right now. And it also sounds like you feel like it's one of the most important things you could be doing for your overall health. And another little caveat there is anytime I'm making a statement like that or a double-sided reflection, I personally always try to end on the change talk side of things. I'm going to present them with the sustained talk, give them back the change talk second, and then try to get them to expand on the change talk side of things. Also, you can emphasize autonomy. You can reinforce their control over their behavior. Like, hey, nobody can tell you what to do. If you decide to exercise regularly, it's going to be because you want to do it. And that's totally true. And it can make people feel a lot better about that instead of feeling like they're getting coerced into something, pushed into it, because that everybody usually has a negative reaction to feeling like they're being forced into something. Other kinds of things, you can suggest a different meaning or perspective about what they're going through. You can agree with the twist. You can reflect and then reframe. You can, sometimes, I'm sure you all know or have had the experiences when people are just full of sustained talk. They really want to tell you about all their barriers and why they're not able to do something. If I'm getting that sense from somebody, I may just say, give it to me, tell me all the reasons. I want all the reasons that you can't exercise. Let's just get those out of the way. Tell me every single reason that you're not going to be able to exercise. Okay, now that we've got those out of the way, now tell me why you think it could be a good idea for you. So I'm trying to get it out of the way, push it aside, and then focus in on change talk. Coming alongside, I can agree with them. Yeah, maybe now is not the right time. You're probably never going to have time to exercise. And then you're likely to get a response like, "Whoa, what do you mean I'm never going to have time? Like, this is something I want to do." And then all of a sudden you're getting change talk again. Okay, and then things to watch out for. Signs of discord. So maybe you notice that the person is getting really defensive. Maybe they're squaring off and they're like, "Hey, who are you to tell me that I should be doing this or that?" Maybe they're interrupting you. Maybe you can just tell they're really disengaged. They picked up their phone and they started doing this during your appointment. Especially in virtual appointments, that happens sometimes. Yeah, so we get that you can tell that they're disengaged. So what do we do whenever we have this kind of stuff going on? Probably one of the better things to do, that may be the hardest, is to try not to take it personally. Remember, our goal is to help them change their behavior, and getting upset about it isn't going to do any good for anybody. I can fall back on my responding to sustained talk strategies. Like, "Hey, I've noticed that you've been pretty engaged with your phone. Maybe right now isn't the best time to be talking about this stuff. Looks like there are other more important things going on for you right now than meeting with me and talking about this." And that's a pretty straightforward way of saying, like, "Hey, it's like, this is what I'm seeing. This is my take on things." Yeah, see what they say. You're just spinning your wheels if they really aren't interested in being there. You could apologize. Maybe whether you did something wrong or not, apologizing can go a long ways. I know in healthcare, we oftentimes find ourselves apologizing for the inefficiencies of our systems and saying like, "Wow, I'm sorry it took us such a long time to get a hold of you to process your referral and get this appointment scheduled." What can we do to help you today? So, I may not have had anything to do with that whole process, but apology can go a long ways in helping the person feel understood and be ready to work on something. I can use affirmations like, well, I can tell, or I started that with an I statement. That's not what I'm supposed to do with affirmations. You're taking this seriously because you showed up today. And so, yeah, so you can make an affirmation about something that you see in them. You can shift the focus of what they're upset about to something else. And so I'm curious, do y'all have any other tips for dealing with discord? When you've got somebody that doesn't want to be there and is combative, what do you do? You got to be fast typers. So I have to move on. Yeah, I give it time, respect their boundaries. That's a really good point, Cassandra. Maybe trying to rush things is only going to make things worse. Giving them more time, showing them that you're going to be there for them, to support them. It doesn't have to happen today. That could go a long ways in showing them that you're serious about helping them. Yeah, those are some nice, yeah, I notice statements. Yeah, just trying to stay more objective about things. Yeah, maybe like, what are you looking at your phone right now? Yeah, what is so interesting? I'm really curious. I want to know what's going on. Okay, so we've got our change talk. We've got our sustain talk. People are talking about what why they want to make behavior change. Now, how can we help them develop confidence to change the behavior? Well, I'm going to give this one away because I am mindful of the time. So importance plus what can facilitate behavior change? I said this at the very beginning of the presentation. Importance and confidence are essential for being able to change behaviors. So once somebody has established the importance of changing the behavior, I want to help them build their confidence in their ability to change the behavior. So once again, I can use my OR skills to facilitate this. I can ask open-ended questions that focus on my peers' ability to change. I could use my confidence ruler. I could say, hey, when I asked you about your physical activity earlier, you said that it was a 5 out of 10. What do you think it would take for you to get to an 8? And when you ask them that kind of question, they're going to start problem solving on their own. And it's amazing, like, what people will do when you just frame it in this objective kind of way. You're like, what would you do? Instead of like, well, so what are you going to do? And so you give them a little space without putting pressure on them, and people will solve their own problems a lot of times. You just got to give them space to be able to do that. And so asking a question like this, what would it take for you to go from one number to a more confident number? You're going to get some answers to the barriers that they're facing. Somebody may say, well, I just have to build it into my schedule. Like, there you go. They are solving their own problem. Okay, and then you can also give information advice when the person asks for it, and you can give them multiple options. Say, hey, you know what? I've worked with a lot of people in similar situations. Everybody comes up with a different solution. Would you be interested in hearing what other people have done? And they're like, yeah. And they're like, well, one person did this, one person did this, one person did this. Yeah, does any of that sound like it could be helpful for you? And another fun thing to do is try to build up on their strengths. Like, you know what? I know that you're a really hard worker. I've seen what you've done in these other areas. I've got no doubt that you're going to be able to apply that same kind of perseverance to what you're working on now. You can review past successes. It can be fun to ask people, if they're having a hard time, like, I just don't know if I can do it. Like, have you ever felt that way before? Was there ever something in your life that you weren't sure that you were going to be able to do, and then you somehow figured out a way to do that? What's an example of that for you? And so you can get them to reflect on their past experiences and identifies their own strengths so that they can use those in what they're currently working on. You can brainstorm, say, hey, if you were to go about doing this, what do you think you could do? Help them make a list of different ideas. You make a list, and then they can pick different strategies to try out. You can reframe. People like, yeah, I tried that before and it just didn't work for me. And it says, I may say, well, it sounded like it worked for you for a while. Just something happened and you got thrown off track. Maybe the same approach would be helpful for again, or maybe a similar approach, but doing it a little bit differently could be helpful. Because oftentimes the same things that have worked for people in the past are the same things that are going to work for them again in the future. So any time they're working on a behavior change that is not, they didn't keep it up forever, they were at least partially successful in that. And so, once again, viewing it as a try rather than a failure, and figuring out how they were able to start doing it, give you a lot of clues about what they could do in the future to make more progress. Tricky little question, hypothetical thinking. Suppose you did succeed and you're looking back on it now. Suppose you did become a regular exerciser and you're looking back at your old self. What did you do? How did you do that? And once again, this is the kind of question that is going to help people start solving their own problems. So we just have to use the way we're interacting, the questions we're asking them to help people solve their own problems. All right, so another thing that's going to happen when you get to this point is you can help them develop discrepancy. And what we mean by discrepancy is we're trying to help them notice the difference between what they're currently doing and what's really important to them. So we've got this silly picture here of somebody who looks like they're trying to improve their health by working out, and they're laying on the couch and eating a cheeseburger at the same time. So you say, on one hand, health is really important to you, and it sounds, it looks like you may be having a hard time to exercise and eat the way that you imagine that you would be in the future. So we try to get people to identify that own discrepancy, accept it, and then that allows them to move on. So yeah, to this point, it's so cool to see this when it happens, but facilitating acceptance is key to overcoming avoidance. If people are not accepting themselves, they're avoiding thinking about the way that they're living, it can be really hard to get them to move in the right direction. But if they can accept who they are, that they're a worthwhile person that maybe has made some choices that weren't as helpful for them, and they are where they are, and they have a say in the way things are going to go in the future, then that can help them or free them up to start making changes. But they have to oftentimes accept where they're at before they can start taking those steps, because otherwise they're just avoiding it. We can use our provide elicit strategy to understand their knowledge of material. Maybe they don't recognize how what they're doing could be helpful. Maybe that lady on the couch tells me, yeah, Kyle, I'm working out, I'm doing some strength training. I'm probably burning quite a few calories, and so it's okay if I eat a cheeseburger. I may say, oh, okay. Well, I'm curious, how many calories do you think you were burning by doing that exercise? How many calories do you think you were consuming by eating that cheeseburger? And then maybe we find a discrepancy there between what they think they're doing and what they're actually doing. We could ask them about other people's concerns about their behavior. What do other people think about what's been going on or what you've been doing? And then once again, having that little bit more of an objective perspective can help them identify some things that maybe they wouldn't, that they may be avoiding kind of subconsciously otherwise. We can ask them about their goals and values, what's important to them, and how they're living their, like I did to you all earlier, how are you living your life in accordance or discordance with these things? And then we always want to honor autonomy, and respect that people are in charge of their decisions that they're making. All right, so change tends to occur when a person identifies discrepancy between what's really important to them and how they've been behaving. We want discrepancy to be large enough to encourage change, but not so large to be demoralizing. And so we're not trying to like beat people down and realize how far away they are from where they want to be. We want to focus on, you know, like, hey, there's an issue here, but there are also things that I can do to get myself on track with where I want to be. So also important note here, if somebody is in the pre-contemplation stage of change, it may not be realistic for you to get them to go from pre-contemplation to action. If you can get them from pre-contemplation to contemplation, that's a huge step in the right direction. So I used the term earlier, like planting seeds. You know, if you can plant that seed that things could be different for them in the future, that's probably a success for somebody who hasn't really been thinking about changing behavior. I am mindful of the time. We have about 5 minutes. So I'm going to skip through my example of trying to help develop discrepancy. We did a pretty good job of that with the physical activity examples. All right, in our last chapter here, developing and supporting change. So how would you know when to go from this evoking stage to the planning stage? You're getting a lot of change talk. So you're getting those desire, ability, reason, need statements. People are talking about commitment, activation, taking steps. You see them going from contemplation to preparation. They're developing a plan for what they want to do. And then our goal becomes helping them execute on what they want to do. So you're seeing more change talk, less sustained talk. People are literally telling you that they're ready to change. Sometimes you'll see this like sense of resolve, you know, where people are just like, yeah, it's time, you know, like I feel like I need to do something. And they've kind of like thrown in the towel to a certain point, but that's also opening a new door for them to be able to do something different. You all probably know that if you've seen it before, and oftentimes it comes right before people make big behavior changes. Envisioning, people are, you know, talking about how their future is going to be whenever they're made the changes that they want. Maybe they're asking questions about change. How do you do this? You know, what have been successful for people in the past? How is this going to impact me in this way? So you can use a strategy called recapitulation, where you take all the bits of change talk, all the gold nuggets that you've mined throughout your conversation with somebody, and you present it back. You know, and so this could be like picking flowers to make a bouquet, or you hand them a bag of gold nuggets, I guess. So yeah, but you present all the change talk back to them, and then help them come up with a plan for what they want to do. So yeah, look at all these reasons for change. What do you think you're gonna do now? So when you get to this point, you may be so excited for them. Watch out for telling them what to do next, because anytime we tell somebody what to do, they're likely to push back on us some. So watch out for the writing reflex, such as saying like, hey, I think you should do this. And you could get some pushback. You know, watch out for change versus sustained talk. If you get sustained talk, back up. Don't push them too hard. Let them come up with their own plans. Yeah, don't try not to get ahead of their readiness to develop and commit to a change plan. Let them come up with it on their own and help them develop a good plan for themselves. So once you get to this point, you can think about goal setting. Many of you are probably familiar with goal setting in different ways. We can be thinking about short-term, intermediate, long-term goals. We want to set goals that increase success and support self-efficacy. We want to set goals that feel like people get a sense of accomplishment or pleasure out of. You can use the SMART goal framework for that. I'm guessing many of you have seen this acronym before, just a set of criteria to make it more likely that people accomplish their goals. You can help them schedule activities, start breaking this stuff down, identify specific times, locations to do what they're going to be doing. This is like the nitty gritty where you like are sitting down with a calendar and saying, what could get in your way? What can we help you do to troubleshoot barriers? What could happen? What could slow you down? How can we help you get through that? I apologize for going really quickly through this. I only have a few more slides left. You can, if people are having a hard time accomplishing what you set for them, break the activity into as small as steps as necessary. Tiny pieces, baby steps, can be really helpful when things feel overwhelming. What do they physically need to be able to participate? Logistical issues, like how will they get there? Who will they go with? And then help them come up with a good plan. Use your insight to think about what could throw them off course and help them troubleshoot around any particular issues they could run into. All right, so we just covered our planning stage. So the final questions I'll leave you all with, and then I'll stick around to answer any questions you may have, are why would you want to use motivational interviewing now that you know more about it, or you've refreshed your memory about motivational interviewing? How do you think motivational interviewing could affect your work as a peer support specialist or whatever setting you're in? And the last question here that I want you to answer in the chat box, how would you know when it was the right time to use motivational interviewing? Yeah, looking at some of these questions, I can do that in just a second. Bradley. And yeah, I think the slides are available. Alejandra, do you all send the slides out after the presentations?
Yes, that is correct. After you complete the evaluations, that gets emailed to you along with your certificate. So slides and certificate will be emailed within the next week or two.
All right, so I'm looking at the responses to my question about when would be the right time to use motivational interviewing, and any time is a great time. So those same skills, this ORS stuff, I think motivational interviewing is not like, oh, I just need to put on my motivational interviewing hat today so that I can help somebody change a behavior. This is like, hopefully this just becomes how you interact with the people you're trying to help. It's really more of a style of interacting with people rather than I'm going to do XYZ when I'm working with this person. So it can be hard to define in that way, but hopefully you're able to incorporate elements of motivational interviewing into your work, and hopefully you like doing it because it feels better and you're more successful in helping people change behavior when you do it. And it just kind of builds on itself whenever you get into a good relationship with motivational interviewing. It's just how you do business or how you interact with people in a professional or helper kind of setting. So I hope that you all find that for yourselves. I'm going to start answering some of these questions.
Okay, since we are at time, I just wanted to make a couple closing remarks before you answer those questions. So again, please complete the evaluation. That helps us improve these sessions, and it also makes you eligible to receive a CEU certificate. If you had any issues or have questions about the CEUs, email emore@janus.org. That is in the chat box. You can also sign up for our newsletter and check out our upcoming events using the links that I shared in the chat box. So thank you all for attending, and I'll let you answer a couple of those questions, and then we'll end this here in a couple minutes.
Okay, yeah, thanks, Alejandra. And then, so if anybody, you've got everything you need, you got something else going on, feel free to take off at this point. But I will try to answer some of the questions, starting with Bradley's questions about facilitating acceptance. There's some things that people can do to help people facilitate acceptance of themselves. Probably my favorite way to think about this is self-compassion, or like from that kind of angle. And, getting somebody to say or think about what would you tell somebody else or a loved one in the same situation? Let's say somebody's having a hard time coming to terms with some of the decisions that they've made in the past. And, you ask them to say, well, let's say your kid came to you with the same thing, and your kid says, I'm just having a hard time accepting, like I really screwed things up. I did these things that cause so many problems for other people, and I don't know that I can live with myself. Like, how would you respond to somebody you really cared about? And oftentimes, people are really able to find some empathy for other people in those situations. They're like, hey, in the circumstances, lots of people make the same kinds of decisions you did. That what matters now is that your heart is in the right place and you're trying to make some changes. And so by flipping things around and asking them what they would tell somebody else that they cared about, and then asking them to think about if they could apply the same things to themselves, can be super helpful in getting them to a place of acceptance. Excuse me again. So yeah, self-compassion can be something to think about in those situations. And actually, that may be the only question I have. Does anyone else have a particular question? Yeah, I wanted to say thank you all for your participation. It's way more fun doing these when you all are interacting, and I think it probably helps you remember the material better too. So, and yeah, they'll be able to send slides. There's also a recording, I believe.
Yes, that is correct. Evaluation will be emailed to you. The slides will also be emailed to you after we issue you the certificate. So that'll all be in the same email. Right. So you all have our staff's email. So if anything else comes up, please feel free to contact us. Otherwise, thank you for attending, and thank you, Dr. Davis, for presenting.
Yeah, my pleasure. Y'all can probably tell I like talking about motivational interviewing. So, all right, well, take care, everyone. And if you have any questions, yeah, you could reach me here or back through Empower Idaho.
Thanks.